Hello and welcome to this very special Banega Swasth India Facebook Live. Today we have an expert with us to tell us where we really are on with this new variant of the coronavirus. We have with us Dr. Julian Tang, Associate Professor, Clinical Virologist, Respiratory Sciences, University of Leicester. Thank you so much, Dr. Tang, for joining us today.
Hello.
Dr. Tang, it's been 2 years of the COVID-19 pandemic. It just seems that it's not going, people had started living their normal life, at least started trying to live a normal life. Tell us a little bit about, before we start taking up viewer questions, about this new variant, Omicron.
Yeah, so this new variant is not that surprising. We see new variants occurring all the time. Some of them die out, some of them persist. We've seen the Alpha and Delta variants persist across the world. Some of the other ones, like the Beta and Gamma variants, persist locally, but don't really spread across the world. And of course, the Californian variant, Epsilon in the US. But this Omicron seems to have a lot more mutations that can escape the vaccine protection that we have in many countries now, and also probably against natural infection with the previous strains of the virus. But this is a natural evolution of the virus, and the human population will gradually adapt to the virus and vice versa. And we might be seeing with Omicron less severe cases, more transmissibility, which is actually what you actually would see in a virus that's well adapted to the human population, like the common cold viruses and influenza.
Do you suggest, it's really important we as individuals take charge and we do, the basic things like social distancing, hand washing and wearing masks is very critical at this point?
So at the moment, we don't know much about the Omicron variant. Certainly in the UK, they are kind of erring on the side of caution and implementing restrictions again, masking, social distancing, vaccine passports, working from home, etc., going towards Christmas, New Year. And that's because you generally see a surge in viruses towards Christmas, New Year, as people tend to mix indoors more often. So this is a kind of, it's a wise precaution, given the UK's rather bad experience with Alpha and Delta in the past.
Okay, so we will start taking, we have a lot of viewer questions. The first one, Arshi Saha wants to know, how can India prepare itself to handle this spread? They would want to know specifically about India. Of course, the overall picture is what we really need at this point.
So again, the previous measures will work against this variant. The variants are not specific in terms of the non-pharmaceutical interventions like masking, social distancing, enhanced ventilation, reduce indoor crowding, etc. All of this will work to reduce the spread of Omicron as well.
So the next question, Dr. Tang, Pranoy Ghosh is asking, how long will we be free from corona? I think that's something a lot of people must be asking you all the time. And it's a difficult one to answer.
Yeah, so we think that the coronavirus will become endemic and seasonal like the other coronaviruses, like the common cold viruses. And it's really how much each individual nation can live with in terms of infection, hospitalization, and mortality. And again, we do this every year with influenza. And we have a focused vaccination for influenza. We have some antivirals for influenza that we give to specific high-risk population individuals.
So I was just coming to that, like we talk about influenza, the flu shot, first they used to say give it to the senior citizens and children. Vaccination plays a very key role here when we talk about the COVID-19 pandemic.
Yeah, so it depends on how severe the Omicron turns out to be or any other subsequent variant. So if the severity starts to drop, fewer people will take the vaccine just because they can't be bothered or they don't like the vaccine. And then what you end up with is a very focused vaccination program of those who are most vulnerable, as we see with seasonal flu. And the coronavirus, SARS-CoV-2, may become like that.
Okay. So the next question we have from Saurabh, that me and my family are in a lot of tension that how big is the threat of Omicron?
Yeah, we're not really sure yet. So we're seeing enhanced transmissibility, but if it comes with less severity and milder illness, it may not matter so much. So at the moment, the data seems to be is less severe from South Africa, but you need to see how it performs in different populations, including India, UK, and US, etc., because they have a higher proportion of patients, say, with comorbidities or transplant or immunosuppressed conditions.
Sure. So I think it's really good to hear, at least when we talk about severity, we've all seen, Dr. Tang, the second wave, Delta was really, really difficult. It was challenging for each one of us. I'm sure we've all been through that. So that's a good thing to hear. Bunny wants to know, what are the symptoms of the new variant? What to know more about it? Can you share that?
Yeah, so we have limited data on that, but from the early reports, we see that this virus tends to produce a more flu-like illness, like fatigue, sore throat, a bit of shortness of breath, rather than the loss of taste and smell that we see typically with Delta and Alpha. So that change in so-called the clinical phenotype may be an indication that it's adapting better to humans and may cause less severe disease, even though it's more transmissible.
Okay. So just a question before I take on another viewer question, I have something. A lot of people during Delta as well, not everybody had the symptom of, the smell and the taste going. Did that have something to do with the severity?
No, so we see this loss of taste and smell across all age groups, from children to adults. And my impression of this, and this is my personal opinion, is that as the virus adapts better to the human population, you'll see some of these rather odd complications start to disappear, as we've seen with influenza and the common cold viruses. So this, to me, suggests that it's changing its kind of clinical phenotype, and it might be towards a more severe, a more mild and less severe type of presentation, which actually would go with enhanced transmissibility in a virus that's more adapting to human populations.
Okay, thanks for answering that. Just going on to the next question, Deprotim Das wants to know, is this variant more dangerous? Of course, you've answered that it's less severe, but since it's a specific question on the danger level.
Well, danger depends on different things. So it depends on your comorbidity status, whether you're immunosuppressed or not, whether you've got other kind of vulnerabilities that we don't know about, because there's some genetic factors that may actually produce more severe disease in Asians, and South Asians and Indians in particular. That's with the Delta variant. So other variants may have different vulnerabilities, target different vulnerabilities in the population. So we can't really say too much at the moment without more data.
Okay, so I think still most important at this point is to be cautious. So this next question as well, Trisha wants to know how severe is the variant, but she has another point to that. What all concerns, should we take for it? I mean, what are the precautions one should take?
Well, you should get the vaccine booster. So if you have not been vaccinated, get vaccinated. If you have been vaccinated, get a booster. And what happens is the vaccine induces antibodies that are cross-protective across multiple variants to some degree that will hopefully reduce severe disease and death from those other variants. And that probably includes Omicron. And some of the early data suggest that it can escape vaccine protection to some extent, but we hope that more severe disease is still prevented from the vaccine.
The next question is again from Anjali Rathore. She wants to know, how deadly is the virus? Are vaccinated people safe?
So we think that the vaccines are probably going to work against severe disease and death. We know the vaccines don't really protect against infection or reinfection with the different variants. Omicron has been shown to escape some of the vaccine protection that we have, but hopefully it will reduce the severe disease and death kind of outcomes.
So I think key here is that, the message out here is, Dr. Tang, that people need to go out and definitely get their vaccine shots.
Yeah, get vaccinated and get the boosters.
Yeah, at least it'll reduce the severity. I mean, that's for sure. The next question is interesting. Of course, it's because, in India as well, I mean, everywhere, especially schools have been shut here for really long. So Tapatap wants to know, what is the problem with closing schools, and canceling boards? Of course, that's specifically for here. Something to do with, they want to know that what can the government do to stop the spread of Omicron to the entire nation? So just a general question, what are your thoughts on students, and especially when we talk about schooling, because schools have just started to reopen here in India and they are again shut?
Yeah, so the thing is with children, they do actually get infected, they can spread the virus and they're not very sick. So it's really, they act as a vector for the virus. So if you close the schools, you close the universities, the young people don't get very sick, but they can spread the virus. If you stop them getting infected by closing schools and universities, they don't get infected and can't spread the virus. But of course, they suffer in other ways. So the government really has to balance that kind of loss of education, loss of social integration with that prevention in ongoing transmission of the virus. And that's always a difficult decision.
Just going a little away again from the questions which we have here from our viewers, I wanted to ask you, we're talking about students, children, the children have been impacted hugely, even mentally, psychologically. How are the children in the UK coping with this, since you're working on ground there?
Yeah, so in fact, the government's very strongly in favor of bringing children back to school, and they have been back to school. They have been tested, and now they don't have to isolate in huge bubbles like they did before. So individual children get tested, and individual students may be isolated if needed. They try to minimize that impact on schooling and the school social integration, education, etc., etc. Different countries, different governments may have different views on this. It depends really how well connected people are at home. If they want to do homeschooling via, by Zoom or Teams, for example. If you don't have a well-connected population where the internet service is poor, that's not going to work. So it really depends on the local situation. And in India, it might be very mixed, and you may not benefit from, homeschooling with internet connections and remote learning in some areas.
Especially in the rural part of the country. Absolutely right. So Dinesh Kapoor wants to know, Dr. Tang, how can we stop spreading of Omicron? And is there anything that we don't know about it? So I guess we don't know a lot of things about it, but...
Yeah, well, we don't know how severe it is across different populations in different countries and different immunosuppressed versus, otherwise healthy young people and children as well. We don't have enough data yet. But to stop it spreading is quite easy. You just basically stay away from people, wear a mask, get the vaccine, get the vaccination and the boosters, and try to avoid crowded indoor gatherings.
Okay. So I think the whole thing here is, of course, it's like you said earlier as well, it's Christmas, New Year's, India just had Diwali, which is, again, a festival of lights. So it is, and people have been in closed doors for a really long time. So it's been tough on everybody. Another very interesting question, Dr. Tang, is Srinivas Kulkarni wants to know, will our current approved vaccines be effective against the Omicron variant of COVID-19?
So some of the early data suggests that the actual protection against infection is not that high. There will be some infection or breakthrough infections, if you like, but the severity of illness that results may not be particularly severe, as we've seen with other breakthrough infections with other variants. So we're still hopeful that the vaccines will protect against severe disease and death.
Just how are y'all, and in the UK at this point, of course, you've said different countries deal with it differently. Just the last couple of questions. How are y'all dealing with this variant at this point? What can India learn?
So at the moment, UK is going to plan B. So they're trying to enhance those precautions, the masking, the social distancing, vaccine passports, working from home. They're taking a precautionary approach because they don't want to go through the same thing they did with Alpha and Delta. If Omicron is just as severe, if it spreads more quickly, but it's just as severe, you get increased hospitalizations, increased death rates. We don't know yet whether it's more mild. If it is more mild but spreads more quickly, you might still get the same hospitalization and death rate just because of the sheer numbers. So we don't know about that just yet. So we're taking more precautions just in case. And of course, those precautions will reduce Delta variant transmission as well as influenza transmission.
So at this point, just to take a closure from you, what would you like to tell our viewers in brief about this variant? Because, there's so much of, yes, of course, one is worried, one wants to take all precautions, but sometimes, so your closing remarks from you, Dr. Tang.
Well, I just tell the people of India to, really take up those vaccinations or boosters, keep your masks on, and especially if you're indoors, try to avoid crowded areas, open the windows, get better ventilation. And if there's any kind of way you can work from home and avoid crowded areas during your place of work or even school, if you can support your children at home, that would reduce the spread of the virus as we get to know more about it.
Just because we have you with us, with your expertise, I just want to ask you a little bit in brief, if you can explain our viewers a little bit about mutations. Because, one always talks about, this variant has been muted these many times. So a lot of people don't understand that. So can you just explain that for our viewers, please?
Yeah, so if you imagine this is the virus here, and this is your antibody induced by the vaccine, in the wild type virus, the non-variants, the antibody from the vaccine can bind well to the virus spike protein, the S protein. But when you have lots of mutations, what happens is that you have different shape changes in the S protein that your antibodies induced by the vaccine can't bind as well to. And that reduces the protection against the virus for those variants. So you have to update your vaccine, or you have to try and avoid getting infected by the new variant that's not well protected by the vaccine. But the vaccine can bind well enough. The vaccine and antibodies can bind well enough to reduce severe disease and death, we think. And also you've got T-cell responses that can also attack the virus in different ways, regardless of the SG mutations. So those mutations really change the way the virus, the shape of the virus and the protein coded by the virus. And that also helps it to escape vaccine immunity. And that's what we have to try and combat with updated vaccines and or just reducing transmission by avoiding infected people.
In fact, you've explained that really well, Dr. Tang. Thank you so much for that. Just a last question, what I would, want to understand from you. Travel restrictions, what are your thoughts on that? A lot of countries, of course, have put down those restrictions. Again, what are your thoughts on that? Any comment you would like to give here?
Yeah, so by the time you've actually identified the variant in India or UK or France or Germany, the virus is probably already there. So it's spreading locally amongst the people there who are already infected. If you close the borders after that, all you do is you stop further new importations of that virus coming into the country to some extent, but those local population members who are infected will continue to spread the virus in that local population. And some of them may not be identified because they've got mild illness, they don't get tested, or they may even be asymptomatic and just carry on engaging with different people and spreading the virus that way. So the travel restrictions are probably not very effective. They may delay the rise of cases, but after a certain number of generations of the virus, those importations will be a relatively small number compared to what's going on locally.
And I know I keep saying last question, but you have so much knowledge. I just want to make maximum use so that our viewers can actually gain a lot. You've told us about, you've explained as a mutation. You've told us about the symptoms. What about the quarantining? Because by the end of it, initially it was like they said 21 days and 14 days. So what do you think would be the quarantine period, or, the infectious, if I can ask you in those words, this period when a person can actually spread the infection to another person? That's again something there's a lot of, one needs clarity on.
Yeah, so for a normal person who's not immune suppressed, we think that the average shedding time is about 10 days. So hence the quarantine period of 10 to 14 days came in earlier. And WHO has also published a document saying 10 days is really the limit of quarantine you need, because after that, the antibodies kick in, T-cell responses kick in, and then the virus is neutralized and doesn't actually shed anymore as a live virus, even though you may pick it from PCR. And the PCR positivity can stay positive for like several weeks. Yeah. With the new variants, with the vaccines that don't really work as well against the new variants, that shedding duration might be longer because the vaccines don't work as well to neutralize the virus so quickly. So you might get shedding for longer, maybe 10 to 14 or even up to 21 days. So normally, if you have a new variant, people are more cautious and they may extend the quarantine and self-isolation period to cover that additional shedding of live virus that might come from a lack of vaccine protection.
This is promise you the last question. I was reading somewhere, Dr. Tang, that there was this person in India, he had, he was infected with Omicron. And then the people, they tested the doctor and they didn't have the Omicron variant. So that means, so there's again a lot of talk on that how is that possible? Because he interacted with them, whereas he's tested positive and he has, when they sent it for test, he has Omicron while the others have COVID-19, but not Omicron.
Yes, it depends on the viral load that's shed. If the viral load that's shed is actually quite low, those people who've been vaccinated may actually not get infected. They may have got infected with Delta from somewhere else, like from home, before they met that person. So don't forget the incubation period for this virus is 5 to 7 days, up to like 14 days. So they could have been exposed to a Delta variant case yesterday or last week and be shedding Delta variant now. And the Omicron case may actually not have been shedding enough to infect that Delta variant case with Omicron as well. Now, of course, you can get dual infection with both variants in some people, and they can mix and produce a new variant, but it depends on how much virus you exhale, you breathe out, and how much virus other people inhale that affects the risk of infection.
I think you've answered everything. You've cleared all the doubts. Is there anything else you would like to add which may benefit people to understand this variant and, to remove, at least to reduce the fear?
Yeah, so it doesn't really matter what variant's going around. If you maintain social distancing, your masking, your vaccination status, and avoid indoor crowded areas, particularly public transport. If you don't wear a mask, try not to take a bus, for example, just walk, then you can avoid getting infected. So really avoiding the infection is not really impacted on by the variant that's going around, because you can actually avoid infection by doing all those things, whatever the variant is that's circulating. So I think unless you have to work in those situations, but even if you have to work in those situations, you don't need to know what variant it is. You just put your mask on, avoid other people, open the windows, and then hopefully reduce the risk of any transmission, infection from any variant that's going around. So don't get too fixated on the variant. Just avoid infection by doing those different things.
Yeah, I think protect yourself, and just something on masks. So what are the masks? Because again, we've used cloth masks a lot, of course, disposable masks, N95. Just the last one on the mask, since you've explained us everything well, since you specifically said, take care of all the precautions.
Yeah, so the masking is effective. If you have one person wearing a mask here, you can reduce the outgoing virus by 2 to 4-fold, so like down to 25%. If you have another person wearing a mask here, that reduced virus going across there is going to be reduced even more by that person wearing a mask by another quarter. Okay, so you can actually reduce the virus going out by, down to 1/16. So if you have 1,000 viruses leaving this mask, it might be reduced like 250, and by the time it gets to the other person, it's reduced to like maybe 16 to 20 viruses if you're both masking. And this is just a surgical mask. And the cloth masks that you wear are about half as efficient as that. So you might reduce the aerosols going out by half and the aerosols coming in by half, but that's still overall a quarter of what you would have been exposed to if neither of you were wearing a mask. So obviously the more people that wear the masks, the more likely you're going to protect each other.
Yeah, and reduce the transmission.
Yeah.
And social distancing, you said, and hand washing is equally important, because at one point it was all about sanitizing, hand washing.
I don't think hand washing is that important for reducing the spread of this virus. Most of the spread is through people talking at close proximity and inhaling each other's breath.
Yeah.
What I call the garlic breath distance. If I can inhale your garlic, then I'm breathing in your virus as well. And that's usually across a typical 1 meter conversational distance. I think people just have to be aware that someone they're talking to or interacting with, whether it's a shopkeeper or a bus driver or just someone on the street, they might be infected and not know it. And you could be sharing the same air with them and inhaling the virus. So if you're close enough to smell their breath, whatever they've had for lunch, you are at risk of inhaling whatever virus they might be exhaling, even though they don't know they're infected. So just be aware of that. And even family members, because we know that most transmission occurs in the household, even family members can actually be a source of the infection. And of course, you can't live separate from the family, but then that's just a risk you have to take at home. But you can reduce the risk from outside the home and avoid bringing those viruses back into the home as well.
Thank you so much, Dr. Tang. You've explained everything really well. Really appreciate you joining us on this very critical issue. Thank you so much for clarifying all these doubts and taking all our questions.
Thank you.